Hi everybody, my name's Steph George. I am a licensed massage therapist practicing in Portland, Oregon, and today I'm back for part 3 of my self-care series for upper back pain. Parts 1 and 2, I talked a lot about the pecs. We did a stretch and we did a self-massage technique to try to open the chest to help deal with upper back pain. So the premise is that a lot of this discomfort that you feel in the upper back, this tissue here between the edges of the scapula and the spine, that is caused by the tightening of these muscles in the front, that they're pulling you in and rounding the upper back, and then you feel the discomfort on the opposite side. So today I want to talk to you about the rhomboids, which are a really huge piece of this puzzle. And the reason for that is that they generally will be weak in this whole equation. So as we work to release the pecs and open that whole area, the strengthening of the rhomboids is going to be key in this, because that is just going to help the whole situation to get your shoulder girdle back into a more neutral position. And something that's really common that can happen if you lift weights, if you train in any way, or if you are just chronically in a rounded position, like you have poor posture at your desk and you work on a computer all day, or you have like an intense hobby where you're just really rounded in for hours at a time, things like that. Especially the overtraining. I think it's really common for people to work their chest really hard and then kind of ignore their upper back. And they think with like lat exercises that might be enough. But you really want to specifically work the rhomboids, because those are going to, because they attach from the inner edges of the scapula and to the spine, the strengthening of those is going to help pull everything back to a more normal position. So the way that looks for an exercise, so your basic start to this is just going to be, pulling your arms back, and then at the end of that motion, pinching the edges of the scapula together. And you would treat this like really any exercise. Do a set of 10, take breaks, and maybe do 3 sets. And doing that a few times a week would be ideal. But again, if you are like really training your chest hard, you might want to back off of that a little. Or if you are again, spending a lot of time in kind of a rounded position, you might want to do this pretty regularly. I would certainly give this exercise some attention. It's going to be pretty important for balancing things out. So once you feel like you've gotten kind of strong and you want to graduate to something with resistance, I've just got a resistance band here with handles. This is like a tubular one, and I've just wrapped it around some furniture legs. Any like heavy piece of furniture with legs is fine for this. And you just want to do the same motion. So you're pulling back with the arms and then pinching at the end. And you want to make sure that pinch is happening. If you're only doing this and not the pinch, this isn't really going to be doing much for you. So make sure you get that pinch in at the end. If you're not sure if that's happening, you might want to ask a loved one to put their hand like in between those bones as you do the exercise, and ask them if they feel the tissue contracting or if they feel the bones coming closer together. So that will be a pretty good sign that it's working. So that's your next piece of homework. I wish you luck with that. If you have any questions, please let me know in the comments. And I will also attach an anatomy photo so you can see what I'm referring to here as far as the rhomboids goes. Thank you so much for watching today. I really appreciate it. If you could like and share this video, that would be amazing. If you are interested in booking an appointment, my website is stephgeorgelmt.com. Thank you so much, and I'll see you soon.